Hey, everybody. For those of you that were just watching me, I had to start all over. Just too much noise going on. Um, okay, so I've had a bunch of you ask me um, to tell about my heart attack, um, what were my symptoms, and what have you. Um, First of all, if you're having any kind of chest discomfort, you need to see your doctor. Okay. And if it's really bad and in the middle of the night, go to ER. Okay. Now, for years, I had to go because I had a reflux. Uh, Starting at about 19. Um, so, I ended up having to go and they put me on Reglan, which you can't really get anymore. Last I checked, it's not even prescribed anymore. I think when there are still some people that I was giving meds to that were still on it. But anyway, um, doctors don't really prescribe it anymore. It was causing other things to go on. And anyway, so, I had been having these little episodes throughout my life. Um, and it just so happened that my friend that I'm staying with now had uh, come up to see me. Um, and I had worked that day and I felt tired, but I worked 6 to 2. So a lot of times, I'd get up at 4 in the morning to be clocked in by 5:45. And then I got off at 2:15. And, uh, you know, working day shift always made me tired anyway. I didn't even think nothing about being tired. Just pasta dishes. And uh, I ate my salad and took 1 or 2 bites of my pasta. And I was like, I looked at Robert. I was like, I'm just too tired. I don't even feel like eating anymore. And it was already around 9 o'clock and I needed to get in bed. So, um, I made sure he was going to be okay in the spare bedroom. And I went and, all this time I'm starting to feel that little bit of burning in my chest. I'm like, great, I'm going to have heartburn. I need to get to sleep. And now this is going to keep me up. Well, I get in there in my room, I lay down, and it got worse. Which, if you have a reflux, anybody that suffers from acid reflux knows that when you lay down, it usually does get worse. So I sat back up. I thought, well, I'm gonna have to sleep, uh, you know, propped up on my pillow, half sitting up anyway. So I laid there, and it kept getting worse and worse, and it like pressure. And so I sat up on the side of the bed, and I thought, man, I kind of got up and walked around, and all of a sudden my jaw started aching really bad, like not a sharp pain. It felt like I had been playing tug of war with my jaw for hours. That kind of ache, tired ache. And then all of a sudden, and when I told my cardiologist this, he was like, never heard of that. You hear people saying their left arm went numb, what have you. I didn't ever go numb anywhere. Um, my elbows started burning. I mean, they felt like they were on fire. And almost as soon as that started, uh, I started getting this tingling all up in this area of my face. My whole face was tingling. I mean, massively tingling. And I'm like, okay, something's wrong. So I went in there and I got Robert up. I said, something's going on. You need to get up and take me to the hospital. And he's like, oh, okay. And he was hawing around. I was like, now. We need to go now. And so he sped it up. Anyway, we get in there, and by the time I walk in ER, I can't hardly breathe. I just could not breathe. And they get me in there, and they take my blood pressure, and she didn't even say anything to me about the blood pressure. I don't even know what it was, but she left for a second and went and got a nurse, and the nurse came in there, and they automatically took me to a room, started hooking me up to all this stuff. As a lot of cigarette, big no. Anyway, so I get in there to the room, and when they laid me down, I really couldn't breathe. And so I was like, I was trying to say I can't breathe, and my friend had went in there with me, and I was laying there, and all of a sudden, I just felt like I was going away. That's the best way I know how to describe it. I was leaving my body. And so I remember turning over in the hospital bed to tell my friend something's happening. And then I just was gone. What I know from that point on is just what people have told me. I remember my daughter coming in. I guess Robert called her, and she was standing there, and she's like, Mom, are you sure it's not just heartburn? And by then I couldn't talk. I had no air. And I just shook my head like, no, it's not heartburn. Anyway, so that's the last thing I remember is turning over and trying to tell Robert that something was happening. And evidently, I flatlined. All the bells started going off. He ran and got the nurse, and here they all come with the crush cart, wheeling me down and doing this and doing that. And I woke up. I opened my eyes, should I say, and the doctor is literally right in my face. And he says, Miss Baldwin, you're okay. You just had a heart attack. And I'm like, I remember thinking, what? Really? And he said, we're going to put you to sleep, and we're going to transport you to Oklahoma City to the heart hospital. And I was just laying there like, okay, and the pain was still there, not as bad as it was. I'm sure they gave me nitro. And what happened actually, when I first got in there, this nurse came in with a nitro tab and a baby aspirin and told me to put them under my tongue. And so that's what I did. And I remember thinking, what is she doing giving me nitro and a baby aspirin? It still, you guys, has not occurred to me. And me being in nursing, it hasn't occurred to me yet that this could be a heart attack. I mean, it had crossed my mind, but I'm like, no, I don't even know what else I thought it could be. But anyway, I guess just denial. And the minute that she put that in my mouth and left the room, that's when it was pretty much lights out. I mean, come to find out later, the reason being was my artery was so blocked that, nitro, when you take nitro, it's a vasodilator. It, you know, expands your arteries and veins so more oxygen can get through, and more blood, which carries your oxygen. And anyway, so when that happened, what it did was just really, I mean, my vein, that blood clot had gotten stuck in there, and it was already under pressure, and that nitro just finished it off. And there I went into full blown cardiac arrest. Anyway, so they get me stable, and they go ahead and put me to sleep to ventilate me or intubate me, and put me in the ambulance. And Oklahoma City was about an hour and a half away. It was in the middle of the night, and so traffic was better, or it would have been anywhere from 2 to 2.5 hours away, depending on traffic. But anyway, so I remember waking up in the ambulance just for a second. And I guess the EMT that was sitting next to me put me back to sleep. But I do remember waking up, and I just had this god awful claustrophobic, horrible feeling. I mean, this mask on my face, and then you've got that tube down your throat. And I remember reaching up for it. First of all, I didn't know what was on my face. I didn't know what was going on. I just knew it didn't feel right. And I remember him taking my hand and putting my hand down, and then I went back out. I'm sure he pushed something in my IV. And this was late on I believe it was a Friday night. Yeah, because I was supposed to, Saturday morning was my last day on my rotation at work. And so anyway, we get to Oklahoma City to the heart hospital, and they do what they need to do. And sometime late the next morning, I woke up, and by this time, my mom is there. She drove up from Fort Smith, Arkansas, and people just started telling me, what they done, and how close a call it was. If I hadn't gotten basically, if I hadn't had that heart attack in ER, I probably would not have made it. It was a pretty bad one. There's different levels of heart attacks. There's interruptions, I like to call them. They're all per se heart attacks, but some are more serious than others. Some are just to tapping on the door going, okay, something's wrong. And you don't ever actually go into full blown cardiac arrest. Your heart doesn't ever actually stop, but they catch the problem, and it's usually a blockage. It's usually a blood clot that is formed somewhere. And one of your 4 ventricles, or your 2 ventricles, or your atriums, or wherever, somewhere in the heart. So when I was awake enough that I knew, pretty much what was going on. I mean, it it was pretty shocking to realize how close, that I came of not being here. And I think I spent 4 days in the hospital. And of course, all this is new. And what helped me was that I have been a medication nurse for 23 years. Well, at that time, 19 years, how many ever. And so when they brought me my medicines, I knew what they were for. Well, 98% of them anyway. The IV drugs, I'm not versed at because I don't do the IV drugs. But anyway, so I knew being in nursing, I knew a lot about it already. The trouble that I was having was the mental anguish that went with it. First of all, you're pretty much in shock. It's like, wow, how did that happen out of nowhere? And this is another reason I decided to go ahead and tell you all this full story, because anyone can have a heart attack. You don't necessarily have to have a family history of it. You don't necessarily have to be living a risky lifestyle or even be a smoker. I think a lot of it does have to do with your genes. I think a lot of it is inherited, and I'll explain more about that in a minute. But truly, up until then, guys, I had never been a drug user. I did, do smoke. I'm not going to say, I was a major exerciser. No, but, I worked every day 8 hours and I was on my feet moving all the time. To me, that's exercising. I haven't ever been really bad eater. I'm not one of those that are, per se a health nut or that I eat healthy all the time. No, but most and generally, I eat pretty right. So, it could happen to anyone. My cardiologist blamed every bit of mine on smoking. He says, I'm convinced that smoking caused this. And back then I was a lot thinner. So it sure wasn't my weight. I clocked in at maybe 110, 115 pounds. So, the only thing they had to blame it on was my smoking, which granted does not help. But I kept thinking to myself, that cannot be the only reason that happened. And, here's another good reason that you should know your family history if at all possible, because heart disease is very hereditary. Come to find out, my grandpa died very young of heart attack. The first one he had and the last. There were different, they were not like instantly immediate, but like grandparents and great aunts and uncles and cousins, and heart disease just seemed to run on both sides of my family. So I thought, well, maybe, maybe smoking did cause it, but something in my mind kept telling me, no, that's not all there is to it. And so anyway, whenever you come home from the hospital, I lived by myself. And to be quite honest, you're a little bit afraid. I mean, I was. I mean, I'm a pretty tough boot, but I just kept thinking, oh, what if it happens again? And what would I have done if Robert hadn't have been there that night? If he hadn't decided to stay, he was going to leave the next morning when I went to work. I would have been there by myself. Of course, knowing me, I would have driven myself to the hospital and I would have had time, judging by the way the events happen. But I know whenever I came home from the hospital, I left on a Wednesday morning, I believe it was, and I had to get back to Elk City, and we had in-service that day, and it was payday. So I get home real quick. I'm pretty much just trying to carry on like nothing happened. And my doctor had told me, take a week off. Well, how am I going to take a week off work? I've got bills to pay. That week paycheck is, if I don't get that, that's going to put me way behind. And I had only been working there. Well, I moved in my house on July 29th. I went to work August 1st. And I had this heart attack on November 4th. So, I mean, it's just like boom, 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 I had bills to pay. So anyway, I get there, my director of nursing, I walked up to her and I said, hey, and she's like, oh my God, what are you doing here? And I'm like, well, it's payday and I need money. I'm still alive, and she's like, oh my God, I can't believe you're here. She said, I would have sent somebody, I would have brought you your check myself. Anyway, we laughed about that. And I told her, she said, well, when can you come back to work? I said, well, the doctor has taken me off work for a week. I think I, can come back on my next rotation, which would have been on, I'm not going to do the happy math here with y'all, but to, flop back into my rotation so it didn't mess with the other girls' schedule and I could get my money. And anyway, I had to take that week off because it was doctor's orders. And anyway, I get through the meeting and I get back home. And Robert stayed there with me for a couple of days. But he had to get back to his own doctor's appointments. And so when he left, I was by myself, so I had a lot of time to think. And it was pretty scary. I was trying not to smoke, which just raised my anxiety level even higher. You just go down rabbit holes, dark ones, your life, or mine did. My whole life just started flashing before my eyes, and it's scary. You're wondering if it's gonna, happen again. Every little twinge in your chest makes you go, is it happening again? I mean, you're a little paranoid, and understandably so. That's a major life-changing event. My thought processes just changed. When they say people that have NDEs become different people, I believe it, because your thought processes just are different. I decided I hated my career. um, Believe you me, any of you that's ever been in nursing knows exactly what I'm about to say. Although we love our jobs, most of us, we enjoy helping people. Um, it's, our calling, but it's also hectic, aggravating, depressing, all the above. And so I don't know. I just thought, okay, I got to do something different. I don't want to be depressed anymore. I don't want to be sad. Blah blah blah. I've got this new chance, and at the same time, you're afraid too, and you've got all these medicines that you're having to take. You know, I hadn't ever had to take medicine in my life except for an antibiotic here and there or a pain pill. You know, um, I had actually been pretty fortunate. I mean, I had a couple of things go on, but they were like um, emergency type stuff, like dislocating my shoulder and busting my head open, and um, my gallbladder almost exploding, stuff like that. But other than that, I was always an extremely, what I thought, a very healthy person. I didn't even hardly ever get sick, seriously. Um, the only thing I can think of that would have given me half a clue would have been a couple of years before then. I decided I was going to start taking my blood pressure, mainly out of curiosity. Um, and I used to have these headaches. Every once in a while, I'd get a really bad migraine headache. I mean, to the point to where, you're throwing up type pain. And I got to where I checked my blood pressure, and it was actually very high. And for me to be as small, as thin as I was, that kind of hit a chord. I was like, it shouldn't be that high. That's not normal at all. But I ignored it. Just went on about my business. And it was just a couple of years later that I had my heart attack. um, they tell you to change your lifestyle, quit smoking, your diet, um, to exercise, stuff like that. And everybody's situation is and will be different, just depending on you. Um, some people can't exercise. Some people have other issues that, they just cannot exercise. No strenuous. Most people can um, walk, you know, but I mean, come on, you know, I worked at least 8 hours, sometimes more a day, at least 5 days in a row, sometimes six. You know, I walked all day long and I was tired. Hey, area trance. I'm discussing my heart attack. I had people ask me about it. So, anyway, you go through a lot of different emotions inside. Um, because it's a life-changing event. um, Pretty scary, and I try not to worry about it now, but it's been what, uh, almost 7 years, and I still wonder, now the cardiologist I have, she is very thorough. In fact, just last February, I had a complete workup done. She did a stress test, um, and I had an echo of my heart done. So everything, knock on wood, is okay now. As okay as it's gonna be anyway. And I even got taken off of 2 of my meds. I mean, guys, I was taking like 9. I think it was 9. Uh, my triglycerides were awful. So I had to take Tricor, and of course Plavix. They're going to put you on Plavix. That's an antiplatelet. It makes damn sure that you're not going to clot. And then on top of that, a baby aspirin. So there's no worrying about clotting. That's for sure. So what they ended up doing was placing a stent in my heart. These stents that they have nowadays are actually very good. Before, I can't remember how it all goes. You can research it if you need to. But, everything is trial and error. So throughout the years, they've come up with certain stents that didn't work so well. Some of them were clotting or even breaking. So, nowadays, the stents that they use are actually very, very good. And they figured out that when they put the stent in, that they'll give you it's a medicated stent, or the one that they put in my heart was medicated. And the medication lasts, I believe, 72 hours. It's pretty much just to make sure there's no clotting, and it keeps it, clear, because what your body does with anything else, it'll build around it. If you've ever had a splinter per se, this is just the best example I can come up with. If you've ever had a splinter, you'll notice, that if you don't get it out, or you may not even know you got one until it starts festering up, because your skin's already formed over it, and your body's trying to push it out, so it'll form that little blister or whatever. Anyway, so when they place the stent in, they have to put medication in there so your body doesn't reject that stent. It kind of fools it into thinking it belongs there, and then when your artery starts, reforming around it, you've got new growth, then it's about enough time that medication and that stent wears off, and you're good to go. One of my mother's sisters, she had 4 stents in her heart. But anyway, besides the mental part of it, I pretty much went back to normal. It does make you think different. It sure makes you put your priorities in order, about what you want out of your life, and you being happy. I didn't get as depressed as some get. I just tried really hard not to worry about it. I tried to just go on with my life, and pretty much act like nothing happened. But I'll tell you what, I had been back to work probably, it was after Christmas. It was around February of the next year. I thought I was going to have a nervous breakdown. I was like, okay, all of a sudden I think one of the patients that I was taking care of kind of made me get triggered a little bit, and I remember leaving work that day going, I can't do this anymore. It's just too damn depressing. um, I don't know. And from that minute on, I just started thinking so many, I won't say weird thoughts. They're very normal thoughts, but I don't know. Like I was thinking, okay, what if Robert hadn't been there? What if this had happened and I would have died here in my bed or in my house? Nobody ever came to see me. I had have a daughter that lives there, but she didn't ever come over. I could have been dead in that house. Somebody from work would have eventually, maybe come and banged on my door going, why ain't you been at work? Most of the time in nursing, if you don't show up, they just put you no call, no show, and you're out of there. They just assume you didn't want to come to work. Sometimes they do go check, depending on, but they didn't know me well enough. I'd only been there, I don't know, 4 months, August, September, October, going on 4 months. So that was kind of scary. I'm like, oh my gosh, I could have laid here dead all for who knows how long, for anybody even found me. Maybe my landlord, when she come to evict me because I hadn't paid rent a month later, I don't know. But it puts you, it makes you think about stuff. Now, like I said, every person is going to be different. Women, their symptoms are different than men's. Usually a man will have your classic symptoms, the pressure in the chest, the left arm tingling or going numb. They're pretty much most of the time about the same, but we're just completely different. When I told my cardiologist what my symptoms were, he was like, I have never heard of that. My elbows tingling. Both of them were on fire. The jaw pain, that's pretty common, a pretty common symptom. But anyway, I was dead set on getting to the bottom of that. And I was like, what caused this? It could not. I was convinced it couldn't be just my smoking all by itself. Granted, it doesn't help as I light a cigarette. But anyway, I was only 49 when I had my heart attack. And then what was it? 2 years later. No, I guess it was longer than that. I'm 4 years. So it would have been 3 years later. One of my younger sisters had just turned 50. And she had a heart attack that was worse than mine. And mine was bad enough to, well, it killed me for a little bit. Hers was worse than mine. And she's never smoked a cigarette a day in her life. And she eats pretty healthy. She exercises all the time. She either goes to the gym or runs or both every day. And then, she has one. So I'm not telling you to go crazy and just do whatever and not watch your health, because, that ain't at all what I'm saying. What I'm saying is sometimes it doesn't help, and it's very important to know your family history, because I'm telling you, if your mom had one and your grandma had one and so on, you're probably at risk, okay? Um, so you need to know your family history. And yes, it always helps to try and stay healthy for many, many reasons. Not just this one, many health reasons. But it's kind of like a crapshoot, isn't it? I mean, I know people that have been diehard drug addicts off and on their whole lives. Um, you know, haven't ever had an issue. And then you've got people like my little sister that don't even smoke, that exercise every single day, that eat right, and she has a heart attack. So you just never really know. All we can do is, you know, try really hard to take care of ourselves, I guess, and hope for the best. Just like with diabetes, I was thinking about that the other day. There's a lot of medications that um, can cause your blood sugar to go up. I'm not going to say that it causes you to be full blown diabetic, but over a certain amount of time, plus with your lifestyle, with your diet, um, it could sure turn into it. I just consider you a pre-diabetic. Um, but usually, if you're on something like that, your doctor will already know and will tell you, hey, this is going to raise your blood sugar. Be careful, blah, blah, blah. I was watching a video earlier. Um, well, I've watched several of them, but I'm not going to tell you about that one. I will tell you about this woman that um, she was talking about having her heart attack. She pretty much, didn't have any family history. Uh, and I don't know how to put this without sounding like, I'm being a, what, but there's no way that people are that. No, okay. I'm not going to say it because it does sound tacky. I'm not meaning it that way, but like for instance, she's on here telling everybody she had this, making it sound like she had this major, huge, heart attack, and it was uh could have been, yes, but she didn't actually go into full cardiac arrest. She did get to the hospital before her heart actually stopped, arrested, and she had a stent placed. Okay, well, um, now, granted, I'm in uh, nursing. Medication is my specialty, and I do know that doctors or the nurse, somebody, uh, before you leave the hospital, goes over your med list with you. I mean, I don't know of any time that they haven't, either when I was a patient or when I was working and stood there and listened to the doctor or the RN go over the medication list with the patient before they were discharged. Um, well, this lady was saying that no, they didn't do none of that. Well, okay, I'm not going to call her a liar, but I'm saying it's very rare that that would happen if something got shuffled around and lost in the proverbial paperwork, because it, that is just something that is always done. Um, but they put her on the typical drugs that you'll get after a cardiac event, uh, your Plavix, which is, like I said, your antiplatelet, so that it doesn't clot. You have your aspirin. Most of the time they'll give you nitro, just as a PRN in case you need it. You'll have it. Most people nowadays will use the spray that you just spray under your tongue. I had the little pills. I did never use them. But she was saying that nobody taught her how to do it. Well, if it somehow gets past the doctor and then somehow gets past the nurse, the discharging nurse, and then somehow gets past the pharmacist, I just don't see how all that happened. But it is what it is. Most people, even not in nursing or in the medical field, know what nitro is, what nitro is about. Now, granted, nitro isn't always just used for cardiac. Well, everything's connected. So I guess in a way it would still be cardiac, but a lot of times we will use nitro to bring a blood pressure down real quick, which can be kind of dangerous. Most of the time they don't want you doing that at home, and they don't just say, okay, here's a bottle of nitro, take it, because what if that blood pressure drops too low? You go from one extreme to the other, you're going to bottom out. Most of the time you're probably going to pass out, and then you could go into cardiac arrest when you're passed out because it came down way too fast. We want it to come down fast, but we want it to come down and stay. We don't want it to keep going down. So nitro's a pretty, I'm not going to call it dangerous, but it's definitely a drug that you need to be educated on, and only take it if you absolutely have to. But like with me, I had an advantage because I already, knew the medications. Now, like say, I still had chest pain. You gotta understand that your body has just went through a major ordeal. Your heart, has had a major thing happen to it. So it's going to take time for it to readjust. Also, with me, them doing CPR, pushing down on my chest and then putting the defibrillator on me. And I mean, when I first woke up, I thought all my ribs were broke, and I was sore even after I came home from the hospital. Almost a week after my heart attack, I was still so sore. And I'd have little muscle spasms and little twinges and pains, but my brain was telling me, well, you've had a workout up there. You had a little nurse pretty much standing on you, bouncing up and down on your chest, which is what it felt like. That's not what she's doing, of course. But, I could have very easily had cracked ribs. Usually when you do CPR, and if you're doing it correctly, you're probably going to crack a rib or two. But that's the price of it. But people need to be told that you don't pop a nitro pill every single time you have a little bitty twinge in your chest. You need to be educated on it. But how are they supposed to know? It's for chest pain. That's what it says. There's no scale, and someone that's afraid I mean, they just went through this major heart attack. I know I was. Every little um, weird sensation in my chest, I was like, oh, not again. Come on. But because I have a little bit of medical knowledge, I knew just to take deep breaths and wait and see what. If it got worse, I would have taken a nitro. But some people don't know that. They'll pop a nitro as soon as they feel one little bitty tiny twinge, which may just be a muscle spasm somewhere in the chest, not even in the heart. But they relate it to that because it's in that area. And so they take a nitro. You take that nitro and you bring that heart rate down and that blood pressure down very quickly, and you can cause more damage. You see what I'm saying? You can make yourself. So I really think that they need to have a little bit more education on the nitro with people that are familiar with it at all. Like this lady wasn't. With me, like I said, it's different because I have administered nitro. I've been around it for years. So I knew about it, but it's pretty scary. You don't know what to think or do. Um, like with me, I had been to ER off and on for years, you know, 30 years, um, with a reflux. But, you know, this was just different. And I don't know why. I don't ever remember thinking, okay, I'm having a heart attack. I just don't ever remember thinking that. And in fact, when the doctor told me that I had one and they were doing this and everybody was rushing around and doing this, getting me prepped. And um, he was trying to explain to me, what exactly had happened. And I heard heart attack and then I didn't hear nothing else. um, because I still just could not believe it. Um, so, and I'm educated in it. I work in that field. I don't know how. I think your body just goes into some sort of a shock value. um, all I knew is I couldn't breathe. That's what I was mostly worried about is I cannot breathe. It literally felt like I had a vehicle sitting on my chest. So, um, yeah, on that nitro, those definitely, there needs to be more education on that. I don't remember a whole lot about being discharged. I think they were a lot less formal with me because of my occupation. But somebody that don't know anything about medication, then yeah, they do, whenever you get any med nowadays, they'll give you the paper that explains it and this and that. Um, but some people need to be told right then, they're already going through, so they may not even be thinking straight, you know. Um, but that's when the pharmacist comes in handy too. Your pharmacist knows about those medications. So, when people just take nitro like it's candy, that is extremely dangerous. Um, even during a full blown heart attack, I mean, you're not supposed to take more than 3 of those. You take the first one. If it doesn't give you any relief, then you take another one. If it still doesn't give you any relief, then you take the third one. Well, as or right after you're taking that third one, you better start making plans to get to a hospital because you're now on your third dose of nitro, and that stuff is extremely potent, you know, nitroglycerin. um, so I don't know, guys, but if you're, and another thing, just a couple of years after I had my heart attack, we had this young girl. She was like, God, in her early 30s. She worked in the kitchen where I worked, and she was my friend on Facebook. Well, I was off work that night or that next morning, so I was up late, and I was on my Facebook, and she kept posting there about how bad her chest hurt, that she had heartburn really bad, and was asking if anybody was around that might bring her something for it, um, what have you. And, I didn't really think nothing of it at the time. Uh, I don't know if I even responded to her or anything like that, but uh, I was off the next day, and the day after I went back to work, and everybody was really sad and this and that. And I'm like, well, what happened? And evidently she was having a heart attack, and she didn't go anywhere. She laid there. I know she was on Facebook for a couple of hours talking about the pain in her chest and calling it heartburn. But of course, she was like 32 years old, somewhere in there. And nobody, and especially her, would have been thinking heart attack. But that's what happened to her. She had a heart attack, and she died right there in her bed. Um, and I found that out, when I went back to work, and it just floored me. I'm like, oh my gosh, you know. Um, I think I did tell her that she probably needed to go on to the hospital and get checked out. And I'm pretty sure I did, and told her about my reflux and how that made me feel. And that I would have to go in and get what we used to call a green lizard. um, I think they call it something different now, but it's like it used to be lidocaine, Gaviscon, and Donatol. Um, they'd mix all them together, and you swallow it, and it numbs all that and calms the heartburn down. But I'm pretty sure, knowing me, I probably chimed in and told her all that, but I don't know. But she ended up dying from it. So I was like, man, that really sucks, because a lot of people don't know. And I'll tell you another thing too. This hasn't happened with me or any of the ERs or hospitals or wherever that I've worked, or I probably would have pitched a damn fit. But, some of these doctors make you feel like crap for coming in. You know, if you go in and you're having this really bad chest pain, and by this time you're nervous and you're scared, it's like, am I having a heart attack? What's going on? And, the doctor kind of acts put off. It may be an ER physician that's, on his 48th hour of his 48-hour shift. You might have woke him up from his nap. Um, and, he's like, no, you're not. Sometimes they can get pretty short and testy and make you feel like crap for even coming in and getting checked out, which they should not do. And it's a good thing I'm not there when it happens, because I would pitch a fit. But so a lot of people are afraid to go, or they just put it off. They say, "Oh, I'm young, blah blah blah," or I don't have that factors. It can't be a heart attack. I don't smoke. I do this, I do that, I eat right. Doesn't matter. We can all do the best that we can do to take care of ourselves, but in the long run, it could be genetics. It could be something you inherited, which I was kind of convinced that mine was, I had it all along, arteries blocking up and stuff. Because I thought back on my blood pressure, it's like, okay, my blood pressure sure is high. But when my little sister had hers, I was convinced that convinced me that it is in our family because, like I said, she never smoked. She's damn sure never done a drug. She exercises all the time. She eats right. I mean, she's the polar opposite of me. Although I don't never have done drugs either, but um, I do smoke a lot. But we can just do the best that we can do. And if you feel that there's something wrong with you, we know our bodies. We know when something just ain't right. Even subconsciously, our body lets us know. That's why we have what we call symptoms. you know, um, if you're worried, talk to your doctor. Do not ignore it because it's your body trying to tell you something. I mean, it may not be a heart attack. It may have something to do with your lungs. It may be something as simple as indigestion. Be many things, but you won't know until you get it checked out. And ignoring it is not going to make it go away. And I'm the worst about ignoring, you know, some issues that I have. I'll complain about them and bitch and moan, but I hardly ever go to the hospital unless it's an absolute emergency. I just can't stand it no more. And people need to stop doing that because, and me included, and now that I'm getting older and I've already had one heart attack, I think all the time because, you know, I always look through statistics and in my field, we're always doing, um, we have to do our continuing education units every year. And, we're always studying about something. So I know that my odds of having another heart attack are pretty good. Usually they say if you've had one, you will probably have another one. Don't get upset about that. Don't freak out about that. And don't cause yourself to have another one if you've had one and you're listening to me. Okay? Just make sure that you're doing the best that you can, um, and that you're seeing your doctor on a regular basis. Um, as they tell you to. Normally, if you've had a heart attack, you're going to be seeing a cardiologist after that from then on, or I do. Most people do. Um, so they can tell you and answer your questions. That's what they're there for. If a doctor makes you feel stupid per se um, about asking a question, change doctors because you have the right to know what's going on, and they don't know what's going on unless you tell them. you know, you tell them your symptoms, and then they gather what's going on. So you need to make sure that you talk to them. Okay. Um, but I don't guess I have anything else to say about it, except that I do definitely understand the being afraid because even today, I mean, it's like I said, been 7 years almost since mine, and still, I'll get, and you may continue to have chest pain. That this is one reason that my cardiologist, my original one, prescribed me metoprolol, or the name brand is Toprol XL, 50 milligrams, because it cuts down on the pains. And that's what he told me. You may still experience pains here and there. Um, but with me, I mean, I've got three other blockages. Two are pretty noticeable. and then one was barely starting at that time. So I just have coronary artery disease. That's all there is to it. Um, so I will be on Crestor for the rest of my life and a baby aspirin. Um, when I deal with anemia off and on, and I have forever. At that time when I had my heart attack, I had almost no magnesium in my body. They gave me 2 bags of magnesium in my IV. I couldn't believe it, you know. So I got to doing my research. And being extremely low on magnesium can cause a heart attack. Um, Same as potassium. Um, you can do your own research. It's all over the web. Um, you have got to have certain vitamins in your body, but not too much of them. There's the kicker. Potassium and calcium you have got to have for healthy heart. Okay, if you take too much, especially the potassium, it'll throw you into a heart attack. Yeah. So you have to make sure you have an equal balance. And the only way that you're going to be able to do that is having your blood work done. If this has happened to you, um, I don't know where all my magnesium went. I'm still studying on that. I asked my mother, which is a retired nurse, I've asked doctors. None of them can explain to me where all my magnesium went. Did I not have it? Is that what was that a player in my heart attack? Was that how do you just lose all your magnesium? How does that happen? I've looked all over the web. It's nowhere to be found, but leave it to me to be different, right? I am very different. Same as with my symptoms, full blown heart attack. And my symptoms are any that most people experience. I mean, the burning elbows, come on, I mean, but everybody's different. And women are different than men in their symptoms. Um, I knew of one woman that her stomach hurt, you know, but I mean, if you think about it, your stomach's right here on your left side, right under your rib cage there. So if your stomach's hurting, yeah, it's probably going to radiate up, um, and could possibly make you feel that way. But I'm telling you, when I was having mine, looking back at that time, something blocked. I don't know, something just blocked me from thinking heart attack. And it may have been self-preservation, because if I'd have known or thought I was having one, I'd probably panicked, and would have made things worse. I don't know, but I still think it's a shock value. But you know, I don't know, guys. Anything that is not right with your body, and we know our bodies better than anyone, get it checked out. And if it's severe enough or worrying you enough, go to ER. Okay? Don't think about what anybody else is going to think. I would not care. If I needed something checked out, and I'll tell you another thing too, though. I've had people go in there and get checked out in ER, and the doctors say they're fine. They're still hurting the next day, and they go to their primary care, and she does an EKG, and it's showing troponin level, or does the blood work, and troponin levels are off, which is the what they check to see if you've had a heart attack. If you've had a heart attack, your enzymes will go up. That's your troponin level. Um, she had or was having an episode. And all along, she thought it was her stomach. Her stomach was hurting. But I think it probably was, just the pain radiating down. And another thing, it all depends on what part of the heart is having the infarction, where you're going to feel it. But most of the time, it's set dead center in your chest. The rest of it, mine was like it wasn't a cramp up. I couldn't breathe, but it didn't ever feel like my chest. I don't know. I don't know how to describe it. It was pain, but not like you see in the movies where people grab their chest or their arm. And with me, it was heavy, and it was burning. It felt like I could feel it growing. It started out like a little bitty tiny flame right in the middle of my chest, and it got bigger and bigger and bigger, and I couldn't breathe. And elbows. Now, I don't know if anybody else that's ever said my elbows were on fire. But anyway, yeah, I survived it. And if you're having any sort of chest pain, just please go, because you never know. I mean, that poor young girl, I'm sure she didn't have any clue. She just thought she was having real bad heartburn. And that's what she kept saying. Oh, this heartburn won't go away. And she was having a heart attack. I mean, and I don't get paranoid. And every time you have heartburn, you think you're having a heart attack. Okay. But I am saying, get it checked out. They can run tests to see if anything at all is wrong with your heart. And then you'll know. Okay. If it's your stomach causing it and you're having heartburn that bad and often, then you need to have an upper GI done to see, what's going on there. But either way, talk to your doctor, because you never know. And it could very easily save your life. All right, well, that's my heart attack story. I hope I had like 4 different people say, can you tell us about that? I don't know if they're having issues or whatever, but I'm not a doctor. I work in nursing, and I have had one. So just take care of yourselves, and anything goes wrong, you see your doctor, no matter what you think. Don't put it off, especially something like that, because it could be the last thing you do, honestly. But also, don't be all paranoid about it either, okay? All right, guys. I'm going to let y'all go. I've rambled enough. If you have any questions, you can ask me. You can email me at the Crone, CRONE 51 at gmail.com, or you can ask something in the comment section below, and I will answer you as quick as I can. Okay. Next video, it'll be witchy again. I just thought I'd go ahead and come on and do that. See y'all later.